health life at seniors today. Depending on which part of the country you are, perhaps you are experiencing heavy to light showers and fairly breezy weather. So I hope you are safe and you're dry, even though the rains are always fun to experience. Every now and then we decide to invite amongst our guest doctors a specialist in emergency medicine. And today we've got Dr. Sonal Shah, who is a specialist in emergency medicine. She's a consultant at the PD Hinduja Hospital in Khar in Mumbai. Let me introduce her first. She is, as I mentioned, associated with the PD Hinduja Hospital in Mumbai, in Khar. She has completed her MBBS from the D.Y. Patil Medical College in Navi Mumbai, and she holds a master's in emergency medicine from the Ronald Reagan Institute of Emergency Medicine at the George Washington University in the US, in affiliation with the Kokilaben Dhirubhai Ambani Hospital in Mumbai. She has expertise of over 13 years in the medical field. Her special interests are stroke and trauma management, and she is affiliated to the Society of Emergency Medicine in India. She has various publications to her credit, and we are delighted to have Dr. Sonal Shah here to speak about emergency medicine. And as the topic says, what every senior needs to know about emergency care. And she is going to be talking about, the various things that you need to know. And you could go to an emergency ward, because these days, and especially in big cities like Mumbai, we don't have the GPs. The family doctors have kind of vanished, or at least their clinics have vanished. So in many ways, it's the physicians in the hospital who are the go-to doctors for many of us. So over to you, Dr. Shah. I would request you to make a presentation, but before I could get you to make a presentation, we've been reading about COVID-19 or COVID-25 as what we could call it now. Since you are in the emergency department of a top hospital in the country, what is the scene like right now?
Hi, good evening. So currently, it is not something that we have to be very worried about at this point of time. But definitely, our masking up game has to be very strong, all age groups included. We aren't getting a lot of critical cases at this point of time, but definitely the cough, cold, fevers, ultimately COVID infections. But it's not as deadly as it was earlier. But still, it's a 50-50 thing. We have to be very vigilant as of now.
So, to our seniors who are there here, what would you advise? One is mask up.
Mask up, hand hygiene, wash your hands, don't step out too often, make sure that you are hydrating well, make sure that your immunity is strong so that you can just fight the infection. Because usually the age group that we are finding right now is the elderly. Most of the people who are coming in with a lighter infection are the elderly age groups. But if we have a good immunity, if we eat well, if we hydrate well, and if we prevent ourselves by following all the personal protection, like if we have our masks on and hand washing, then I think we should be good.
But you do know that masking up is a very painful thing. And,
definitely.
But tell me, many of us, we do have our masks in place. They're kept somewhere at home. They've not been pulled out of our drawers and cupboards for the last 4 years or 3 years. Are these okay to use, or should you buy new ones?
I think we should buy new ones. It's recommended that we buy new ones and use fresh masks. We should not wear the older mask. It's better that you wear a fresh mask every time you step out, and discard the mask if you feel that it has gotten wet or you've used it for a very long time.
No, what I meant is that, masks which are unused, but they're kept in your cupboards.
Buy new ones. Since long we've kept them, we've stored them, and we've kept them. So it doesn't make sense using the old ones at this point
Store
of
them
time.
very, very carefully, I must add.
Yes,
anyway,
indeed.
I appreciate what you're saying. So do mask up, everyone, and be careful. We've followed the drill, not too far away, or not too long ago. So you need to get back to that. As Dr. Shah said, it is not as serious as it was. I don't really know whether we know what the virus is, but be that as it may, we will. You need to be careful. Over to you, doctor, for your presentation. And as always, do watch the presentation. Do remember that this is being recorded, and it will be up on the Seniors Today website on Monday evening, and you can watch it there. You can take your no, you don't have to take your notes just now, and yeah, be just attentive and put on your questions, and we will take the questions after doctor's presentation is over. Over to you, Dr. Sanuja.
Thank you. Good evening, everyone. It's lovely to have such a great audience at this point of time for this emergency care for senior citizen webinar today. So, what we are going to focus upon today is what we usually see. Being an emergency physician, we find a lot of people who come into the emergency department with delayed presentations. So today I'm not here to scare you, but my goal is to empower you so that you are aware that what are the emergency pointers that you can and you should take care. So the few common things which we will be going through today is what do you do if you are suspecting a heart attack? How are you going to identify a stroke? And what are your do's and don'ts when you are looking at a stroke? Or if you are a caregiver and you are taking care of somebody, what should you do and what you shouldn't? As I said, that we'll be going through what do you do when you suspect a heart attack? How do you identify a stroke if you are a caregiver? What should be your do's and don'ts when you are looking at a senior citizen who's suffering from a stroke or you're suspecting it to be a stroke? Usually we find a lot of seniors coming in with a drop in sugar levels. What you can do, or what you can do if your spouse is having a low sugar level at that point of time and you are the only caregiver at that point. Something which is very important, which is fits or epilepsy, and what is the first aid that you can provide before you rush them to the hospital. And also we talking about who should be your emergency contact. In today's world, most of the times we have relatives who are staying far away, we have children who are staying far away, we don't have somebody as an emergency contact right besides us. So we'll just be going through that. So heart attack being a very common presentation in the elderly. So we see symptoms like chest pains, shortness of breath, there's discomfort, there's a radiation of pain. There are subtle signs like fatigability, you are very tired, you are uneasy. All these are some signs and symptoms which a patient would present or you would feel. But sometimes it's a gassiness which you feel and you're like, okay, fine, I don't wish to go to the hospital. But it may not just be a gas. It could be something which is very important that you need to go to the hospital. So not everybody is going to have a chest pain. Some people would have symptoms like fatigue or a shortness of breath. Usually we find this in elders. The people who are above 65, 75, they may not come to us with a chest pain, but subtle signs like having a lightheadedness or feeling fatigued out, easily discomfort or some pain in the arm. So these are our warning signs which tells us that we could be having a heart attack. And some do's and don'ts which we would want you to know is, which I would want you to know is that if you suspect any of these symptoms, or if you are a caregiver and the person is having these symptoms, you should call for an ambulance immediately. You're not supposed to wait at this point of time because time is heart and time is brain. Any amount of time delayed at that point of time could result into a fatal condition for the victim. You should always make sure that you make the victim lie down or sit. And as a caregiver or as a spouse, you should always stay calm in that situation. If advised, if you're speaking to a doctor over the phone and if it is advised that you should give them an aspirin, then you can give them one tablet of aspirin of a full dose, which is a 325 milligrams. You can keep this handy. Usually it is advisable that seniors should have a box where they have this medication available. The one thing which you should never do is drive yourself to the hospital because you don't know what you are having at this point of time. And if it is a heart attack, we don't want it to aggravate much. And you should stay calm. You should call for help. Even if it is your neighbor, you should always go along with someone to the hospital. But do not ignore these symptoms. Specifically the gas. I'm feeling a little acidic. I have some uneasiness. Do not ignore them. It is very essential that seniors should know that a gas could also be something related to your heart. Strokes, more than 70% of cases we see with stroke, and usually in the elderly. And stroke has been fifth leading cause of death. It is essential that we know how do we recognize a stroke. Now, this is a fast test. As you can see, the diagram is also showing you. We need to act very fast. For acting fast, we need to know how do we recognize a stroke in an elderly also. So, as the fast suggests, if you see someone, if you see a victim whose face is drooping on one side, you ask them to raise their arms and they are unable to raise their arms, and there is a drooping of their one side of their body, they are unable to speak, their speech is very slurred, you know that this person could be having a stroke like symptom. It could be a mild, it could be a major, but you don't know. You just have an idea that this could be stroke. So at that point of time, you should call the emergency. If you have an emergency number or a nearest emergency department, you should rush them to the hospital. You should call an ambulance and you should not waste time, because time is brain. Any minute of time lost when you are dealing with an elderly patient who's having a stroke could cause future complications for the person. So we have a time of 3 to 4.5 hours of presentation. In the emergency, we see a lot of patients who come in beyond the time. So sometimes the caregivers, they do not know that, okay, we need to know when the onset started, when did the person have this kind of a symptom, or what went wrong. Once we know, it is very helpful to the doctor to be able to provide you with the correct and the best treatment at the right time. So knowing this is very important. So fast is what you can do immediately if you're suspecting somebody who's having a stroke. Also, there are subtle symptoms which a person would be depicting. If you are a caregiver, if you are looking at them, there could be confusion. They may have some amount of numbness in their hands and feet, which could be related only to one side of the body. They may have some vision disturbances. They may not be able to see clearly. If they are walking, they may losing balance on one side. They may or may not have a headache. Some patients do have a very severe headache. So these are also the subtle signs. Also, let me tell you, sometimes these symptoms can also happen in somebody who's having a low sugar. So we do not know. You may not know at that point of time whether this person is having a low sugar or it is a stroke. So you should act fast, because even if it is a low sugar and if you don't have certain things to treat at home, then the next possible thing is to take them to the hospital immediately, because you will be able to provide them with immediate care and attention, and they'll be able to diagnose if it's a stroke or not. There are some do's and don'ts which we see when we are dealing with stroke patients, or when we see the elderly people above the age of 65 coming to us with strokes, that sometimes the caregivers end up giving them something to eat, something to drink. Let me tell you that there are times when the person is unable to speak, and if you give them something to eat or drink, they may end up choking. So, to prevent that, we tell them not to give anything orally. So, today you should know that if you find that somebody is having a stroke like symptom, do not give them anything through their mouth. What your role should be, you should call the ambulance, you should know what is the time if you are the caregiver. If you feel that this could be, and if you have the facility or the availability of having to check the sugars, if you have a machine where you can check their sugars, you can immediately check the sugars, and if you find them to be low, then you can give them some sugar or some honey and rush them to the hospital. Low sugars will mask something like a stroke, so it is very important that you know what are you supposed to do, and what are you supposed to when are you supposed to go to the hospital. Now, low blood sugars with elderly people, especially since most of the elderly population has diabetes, blood pressure, which is very common, be it a family history or they have been diagnosed with diabetes and they are diabetics. Sometimes their appetite being low, like we see a lot of people when they come in with a very low appetite and they end up consuming their medications for sugars, they end up with low sugar levels. And it may present as a simple sweating. They may feel dizzy at some point of time. You may find that they are irritable. You're feeling hungry, weakness. They may also have some difficulty in speech. They may not be able to talk very well at that point of time. Of course, fatigue. But if the sugar levels start to drop more, then you will find some worsening of the conditions. You may find that the person is having a loss of consciousness. They may also throw some fits, which you will see. They will not respond to what you are talking to them, and there would be severe weakness. So, low sugars, there can be numerous causes why somebody would have a low sugar, especially in the elderly. It can be over medication or not a proper review. Sometimes we've seen that elders don't want to go to the hospital for a review or follow up with their GPs or their diabetologists for a review of medicines. Okay, we are fine, we'll go later. But sometimes the medications need some modifications. And when we need to modify, if they are not modified, if your appetite has reduced and you still continue to take the previous doses, you will end up with a low sugar. In case if you're harboring some infection, then also you may have some low sugars. So it's essential to pick up these signs and symptoms and know that, okay, this is a warning sign. This is the time that I should go to the hospital and I should not ignore my symptom. There are certain do's and don'ts. Like do's, it's very important that if you are staying alone, if you are alone at home and you find that you're feeling dizzy and giddy, and you may feel that, okay, I think my sugar must have gotten low, or I have not had an adequate amount of meal, and I'm feeling very dizzy at this point of time. Immediately, if you have a chocolate bar with you, grab a bite, have a spoonful of sugar, have a glass of juice, or you can have some honey or a glucose water. If you have some help with you, they can probably check your sugars again after 15-20 minutes and see if your blood sugars have increased or not. But you should always go to the hospital or your nearest emergency department or an emergency care center where they can assist you. Again, you are not supposed to, if you find that if you're a caregiver and you find that the person is not responding at this point of time, although the sugars are low, but they are not conscious enough, and don't try to force feed them, because if we are going to try and force feed them sugar at that point of time, they would end up choking as well. So this is something which we need to avoid. It's very essential that we know how senior citizens can prevent low sugar episodes. Definitely, regular monitoring of your blood glucose, regular monitoring of your medications, dosages. You should not skip meals. Definitely, the appetite reduces with age. But if your appetite is less and your dosage is very high, then you're going to end up with a low sugar. So, having consistent, regular meals will help you preventing your low blood sugar level. Medication management as well. You need to go to your doctor if you find that you are having recurrent episodes of low blood sugar. You are facing dizziness and giddiness after consuming some medications. You're feeling very lethargic. That means that this is a time where you need to go and you need to check with your doctor to modify your medications. Always keep a box ready, for like an emergency box ready. If you are a diabetic and you know that you have a tendency of having low sugar levels, have a box which has a glucose, which has a sachet of glucose, or it has some chocolate available at that point of time. So if you feel, you know, that's your rescue, just open the box, have it, so that by the time you reach the hospital, you don't reach towards the severe symptoms of low sugars. One very important thing that we see when we look at elderly who present to the emergency department with fits or seizures. Now, fits and seizures usually start happening in after the age of 65. There is almost a 30% increase in the episodes of fits and seizures that we see in the elderly. It's very important that as a caregiver you should be very calm. You need to know if this person is having a seizure. I need to be calm. I need to know the time when the seizure has started. I can turn the victim on one side. Do not shake them. Do not try to hold their seizure. Make sure that you are just timing it, because the time of the entire seizure is very important. Just turn them on one side because you're trying to prevent them having a vomiting episode. You're trying to prevent any obstructions. So you're just trying to turn them on one side. There are certain do's and don'ts, like noting the time of when the seizure started, turning the person on one side, and staying with the person. Because after a seizure, especially an elderly person will not know. They will be in a very, very drowsy state, which is very common to happen after a seizure. So it is essential that you stay with them and until they don't wake up completely or you don't take them to the nearest hospital. You should never, never hold a victim down who's actively having a seizure. Do not put anything in their mouth. We've had putting onions, making them smell socks. These are all outdated things and these are not recommended. We do not do these. You need to just time. You need to see what's happening and just time the seizure and call for help, rush to the emergency. With fits and seizures, there's nothing much that you can do in the at home. You cannot provide them with medications at that point of time. Best to take them to the nearest hospital and do not feed them anything. In elderly population, we see maximum number of times the diet, like a low sodium, sometimes is responsible for seizures. Also, the age and also low sugars can lead to a person throwing up a fit. Of course, you need to seek immediate medical help if you find that the person is having a seizure more than 5 minutes and they are not stopping in spite of even after 5 minutes, there's a continuous fit that they are throwing up, and you find that they have now difficulty in breathing. That is when you know that you need to rush the person. If you are staying alone and if somebody finds you in that state, even if your neighbor finds you in that state, the first thing is to reach the hospital immediately so that we can give certain medications and stop the seizures and find out the cause why it has happened. Especially if it is somebody who's having a seizure for the first time, it is essential that we do not ignore it and we take them to the hospital at that point of time. A very important thing, who should be your emergency contact? With elders, with senior citizens, most of the time we have senior citizens who are living alone or whose children who are living alone, whose children are far away or they are staying at a distance, and the nearest possible person is their neighbor or probably somebody that who you are trusting with your medical history. So, an emergency contact may not be your child, may not be your spouse. It could be somebody who is trustworthy, who you know will be there when there is an emergency. And that person should actually be knowing what is your medication history, what medications are you on currently, if you are allergic to something, and if your blood group. These are the basic things, because sometimes in an emergency when you're being rushed to the hospital, if the person who's bringing you doesn't know, who's listed as your emergency contact and doesn't know this basic information about you, it becomes very difficult to tackle that and to be able to provide timely intervention for the person. So it's very essential that you choose somebody who knows, or at least the person should be able to unlock your phone. If there is somebody who knows, who's not your first hand relative, who's not your first degree relative, but it's your neighbor, or even if it is your house help or a caregiver, they should be knowing this basic details about your health. It is very helpful for us when we get a patient where we have a background history and a background medication history as well. So this is some important points from emergency care purposes which senior citizens should know, because the maximum time we find them coming in with some chest discomfort, with seizures, with low blood sugars. These are the commonest things which we find that seniors come into the emergency department with. Any questions?
Yes.
Anything that you would want me to?
Yeah. Are you done with the presentation?
Yes.
Great. So we'll start taking questions. The first question is what are the bathroom precautions and bedtime precautions for seniors?
Bathroom precautions for seniors, especially we see that seniors have a tendency, sometimes we get a lot of patients who come in with falls. Bathroom precautions, you should keep rugs which are stable enough, which do not slip off. Because if there are rugs which slip off, there is a higher chance that they may fall. And once you fall, you end up with damaging your bones, you have fractures, and with old age and senior citizens, it becomes very difficult for their recovery period. And then it's like an endless tale. Also, in the bathroom, there should be grab bars or handles so that if they have difficulty in getting up or sitting, they have those grab bars which they can hold and they can get up.
Right. uh, this is somebody who's mentioned about my son has sugar levels at border. What
Okay.
precautions should be taken?
So, if firstly, it's very important to know what is the age of your son and what are we dealing with. So, how old is your son? Sugar precautions, as I said, if he's a diabetic and he has a tendency of having low sugars on and off, you should always have a sugar bag with you. Keep some sugar goodies, keep a toffee, keep a chocolate, or carry a sugar sachet. So, in case if he becomes irritable, fatigued, dizzy, or doesn't respond because his sugars have gone down, or if the person has missed a meal, especially if you feel that they have not eaten their meal and they have had their diabetic medication and suddenly they have these symptoms, then you can give them a spoonful of sugar or a sachet of sugar.
Right. Well, he is 52. We have a question from Meena Goel, who is 68. She is a sugar and high BP patient.
Okay.
She wants to know how to tackle the situation. Well, it's too general a question, but still, any advice that you would
Yeah.
give?
So, if you are a sugar and a diabetic patient, firstly, you should be having somebody who is your constant doctor for diabetes and blood pressure. You need to have regular BP checkups. You need to review your medication every 3 months to see if there has been a drop in your sugar levels. You need to regularly check your fasting and postprandial blood sugars so that we can adjust your medications. And
How
eating
regular?
on time is very essential. As seniors, sometimes we may not feel very hungry and you may skip a meal or you may eat very less. That is not good. Being a diabetic, if you know you have to consume a medicine, you need to have a good amount of food.
How often would you recommend the periodic tests for people who are diabetic and those who are not?
So at least the people who are diabetic should have their blood sugars checked every 3 monthly so that they can have their dose adjustments. The ones who are not, at least a 6 monthly checkup for the entire body checkup is very essential.
Right. There's a question from Akhori Mrityunjay Kumar on how safe are digital and accurate are they digital BP machines?
So, digital BP machines are not 100% accurate, but definitely they are accurate enough to tell us what your blood pressure is. Sometimes there are a lot of battery issues that we face with these machines, but it's not although it is not 100% accurate, but it gives us a 90% value of your blood pressure. But if you find that your blood pressure, you are having symptoms like you're feeling sweating, you are feeling very lethargic, you are very drowsy, and your blood pressure is showing very low on the machine, that means it's correct because you are having those symptoms also. Having it in the house, it's very essential. It at least gives us an idea what your blood pressure looks like.
So what are the tools or instruments for measurement that one should have at home as a routine?
So you should at least have one BP monitor. The BP machine, which is the electronic machine which is present, have a pulse oximeter, which I know everybody must have used it during the COVID times. So having that in the box is very important. Having a thermometer is very important. Having some sugars if you're a diabetic is very important. Having a strip of aspirin tablet if you are already a heart patient and if you have on and off discomforts, you should always carry that in a box. You should have that emergency box ready.
Right. The question that doctor, about somebody asking about the son whose sugar is at
Yes.
border level. The son is 52 years old. Uh,
Okay.
so I don't know whether that changes your response. Perhaps not.
No, it doesn't. We follow the same thing.
Uh, Doctor, you mentioned about reaching an emergency care as soon as one can, but you know
Correct.
the traffic that exists in our cities, whether it is Mumbai, of course, but Bangalore has huge traffic. What do you do when you are not able to reach uh, your emergency
Am
care?
I audible? I lost you.
Yes, okay. I'll repeat the question. I'm saying, you mentioned about reaching the emergency care as soon as you can. If the emergency care, given the
Yes.
yeah, all right. So, given the fact that there is so much traffic in our cities, and reaching emergency care immediately may not be possible. So, what do you recommend to people who have a problem like this, especially in cities like Bombay? We have a lot of people from Bangalore. What do you recommend to them?
So traffic has been a very big challenge when it comes to these emergencies because we that is something which we are not able to tackle. But if these are the few emergencies which I mentioned previously, if you can at least take care of that at home and then try and rush to the nearest hospital. I know it may take some time, but this is the basic which we can provide at home. We cannot provide more care than this at home, especially if we are looking at a heart attack or if we are looking at a stroke. We need to reach to the hospital ASAP. Traffic is the biggest factor now that even we face, because time becomes everything, especially with elderly in heart attacks and strokes, because we have a timeline where we would want to give certain medications, but that doesn't restrict us with the treatment once we have the person reaching the hospital. But basic whatever you can do at home in the following things like a heart attack or a stroke, you should. And your goal should be ultimately to be able to reach. You may not be able to reach a tertiary care center if it is located very far away, but you should have the list of the smaller nursing homes which are available around in your locality. You should have the emergency contacts. You should know that what is nearby to your house and where you can rush.
Right. We have a question from Bomi who
Yeah,
asks, during a stroke or an attack, do we need a
correct.
cardiac ambulance only to take the patients to the hospital?
Yes, it's preferred that you have a cardiac ambulance because a cardiac ambulance comes with a doctor. And once the doctor has assessed and seen the person in the ambulance, they can expedite the things at the hospital, which will provide beneficial care to the person before they reach. So we have a system where we activate, where the information reaches the hospital as soon as the patient has been seen in the ambulance by the doctor. So it's always advisable to call for a cardiac ambulance.
Right. This is a question from Kiran Kapadia, who's 72.
Yeah.
Uh, it says that I had an angioplasty 12 years back and now I'm having trouble breathing. What would you recommend?
So, trouble breathing, there can be a lot of causes for trouble of breathing post an angioplasty. When was the last time that you visited your cardiologist? When was the last checkup that you did? And what were the medications that you were taking lately? If there has been any change, if your medications require any change, or if there is anything which is worsening, like your heart functions. If you've done angioplasty so many years back, we need to check your heart functions by doing a 2D echo. So it's recommended that you do that.
Right. Uh, there's a question from Vijay Ganduri
Yeah.
who asks, is it advisable to give sorbitrate tablet to the heart patient before taking to the emergency?
If it's advised, only then. If you are already having anginal pains and your cardiologist has advised you a sorbitrate to be kept bedside in these scenarios, only then give it. Usually you should not always give, because if somebody is having a heart attack and they are not responding and we've given them a sorbitrate, sometimes by the time the victim reaches the hospital we may not find even a pulse and a BP on them. So until and unless it's been advised, do not give.
Right. And doctor, we have one question that has come in that, all doctors advise us to do our exercises, but it's difficult to do that in the rains. What would you recommend one does in the rains to ensure that one is fit and healthy?
So, if you cannot step out in the beautiful weather where it's raining and you want to enjoy the rain from your house through the window, what you can do is you can just walk in the house. walking is very, very helpful. Even if you are a diabetic patient, you should walk after your meal also. You will feel the difference in your sugar levels improving. So walking in the house, doing some breathing exercises, stretching, and a little bit of yoga, if it permits, if you don't have any other major chronic illnesses where you can move a little bit, just do these. That should be enough. But walking, very essential. Don't skip on your walking.
Right. Thank you, doctor. Thank you for answering so many questions. We've kind of done with all the questions. Just one thing, since a lot of
Yeah.
people joined late, and we have over 200 people who were assembled here. Uh, we've got one question, two questions I've received on COVID. So can you just give a wrap up advice to people to to brace themselves in case they
Definitely.
do?
So, with the current COVID coming again, current virus again hitting us, it is very important. We don't know what is the fatality at this point of time, but we need to be prepared. We need to take care of ourselves. We need to wear our mask. If we are stepping out of the house, we need to make sure that we are eating healthy. Being seniors, being elderly, our immunity is at stake. We are more vulnerable. The elderly population is more vulnerable to getting an infection early. So eat well, hydrate yourself well, wear your mask, wash your hands before you touch anything or before you step out and you come back. Try to maintain as much as possible and have your mask so that you are preventing yourself from the infection. The whole thing is prevention. The best way is mask. Just wear your mask. I know sometimes with adults it becomes difficult because you may feel a little suffocated and you may feel a difficulty in breathing. But if you're stepping out, I think your savior is the mask.
Thank you very much, Dr. Shah, for an amazing presentation and a very detailed. You responded to quite a few questions patiently. Uh, you know, uh, the last time around when we had COVID, even doctors faced a lot of trouble. So, to all of you, members of the medical fraternity, please be careful yourselves. Just as you take care of, all of us, you all need to take care of yourselves as well. So best wishes for that. And thank you to you as well as to the Hinduja Hospital Car team to facilitate this. We will be back once again next Saturday at the same time at 5 p.m. Do remember to pre-register in case you wish to do that. Or, of course, keep checking the Seniors Today website and the newsletters and the Evergreen Club app. Also, remember that Evergreen Club app has a slew of programs through the week, and you can participate in them. They are all free of cost. Seniors Have Talent, Doctor. We have an amazing show which is now in its 18th season, which is only open to 60 plussers, and there are a fair number of people who are participating every season, and so that has started now last week. So yeah, that's about it. And enjoy yourselves and do keep track of what we are doing at Seniors Today. Thank you very much.
Thank you. Bye-bye.
Subscribe now and press the bell icon. Never miss an update.